Good morning, everyone. My name is Kwesi Egan. I work for USAID-funded Systems for Improved Access to Pharmaceuticals and Services program, SIAPS. I'm a principal technical advisor supporting MSH's global technical assistance services for the management of pharmaceutical benefits in insurance and UHC programs. Once again, welcome to this webinar on pharmaceutical management considerations for expanded coverage of essential health services and financial risk protection programs as stipulated and encouraged by the UN Sustainable Development Goals, which looks at increasing the critical availability of healthcare services for all. The critical role that pharmaceuticals and other health technologies, including vaccines, biologicals, and diagnostics, and related services play in meeting the objective of universal health coverage cannot be underestimated. The UN Sustainable Development Goal number 3 calls for countries to achieve financial risk protection, including access to safe, effective, quality, and affordable essential medicines and vaccines for all. Evidence indeed abounds that medicines, vaccines, and other health technologies save lives and improve health. However, we all know that if poorly managed, they can be costly to the health system and also expose individuals to a high level of financial risks and impoverishment. Data from WHO and the World Bank also shows that many low and middle income countries spend a substantial portion of their total health expenditures on medicines. Indeed, in many of the LMICs, 45 to 60% of medicines are also purchased out of pocket by individuals, despite the increasing number of financial risk protection schemes globally. We also know that medicines contribute substantially to health systems inefficiencies. Inefficiencies account for 3 out of 4 of all the health sector inefficiencies that have been observed. It's therefore important that the management of pharmaceuticals be looked at appropriately as we move forward in rolling out universal health coverage for all. I believe we are all familiar with the 3 primary UHC objectives as defined and introduced in the 2010 World Health Report, signified by this cube, whose breadth illustrates and shows the number of people who are covered, and also the advocating that more people will be covered by healthcare programs, and also whose depth indicates the type of benefits or benefit packages that countries need to make available for their people, and whose height represents an indication of what proportion of costs that individuals should bear. In effect, what proportion of costs should be covered by universal health programs. But it's important that the implication of filling out this cube for pharmaceutical products and services needs to be looked at if we're going to be sustainable. And as you look at this dimension, for each of them, there's an impact for pharmaceuticals, and therefore its management must be looked at appropriately. Filling out this cube implies increasing population coverage. Increasing population coverage implies that more people will be covered, and therefore there will be an increased utilization of medicines, either new or old. The volumes of procurements are going to be large, and therefore our systems to strengthen procurement must be looked at. Again, there will be an extended or an expanded geographic distribution, and therefore systems for improving the distribution of pharmaceuticals needs to be looked at. Expanding services coverage may lead to the demand for newer services, for either newer services or for traditional services. In the case of newer services, we may require newer formulations for pediatric cases and for geriatric forms. It's therefore important that we look at how these new formulations can be managed, produced, and made available to the people for which we provide universal health coverage. Furthermore, in addressing the proportion of costs that will be covered for health services, we need to introduce improved strategies for active purchasing of pharmaceuticals. We also need to look at the payment and reimbursement mechanisms for pharmaceuticals. Overall, the programs that we introduce in addressing the various portions of the cube will either have negative or positive incentives for the pharmaceutical system. And it's important that we understand the pharmaceutical system and address the management issues that come up. The recent Lancet Commission on Essential Medicine Policy identified a number of key areas that are crucial for essential medicines policies as we move towards universal health coverage. 3 of which included identifying and paying for a basket of essential medicines to promote equitable access to all. Making essential medicines affordable is necessary to achieve equity in access and also assuring the quality and safety of medicines to prevent harm to patients. Pharmaceutical expenditures tend to increase when countries roll out universal health coverage. For many of these countries, we observe that the difference between the budgets and the actuals are really high. There are several key cost drivers that influence these overruns. 1, a sense of entitlement that tends to be within the populace. A more is better attitude, which leads to a higher utilization of services, coupled with a better access to care that is accompanying universal health coverage. As the populations in these countries age, treating chronic diseases also becomes a major cost driver, which countries need to be aware of. Another reason why there tends to be a difference between actuals and the budget is the fact that the design of the payment mechanisms tend to give financial incentives that may favor overuse of expensive medicines. So these are very important design factors and considerations that we need to look at and be able to address in the pharmaceutical system to enable the sustainability of health insurance or universal health coverage programs. Understanding the pharmaceutical system is a key step in improving pharmaceutical management. The pharmaceutical system is a subsystem of the larger health system. It comprises all the structures, namely the medicines regulatory authorities, the central medical stores, the hospitals, the public health facilities within the system, all the resources in terms of human resources, wholesalers, the manufacturers within the subsystem, and the resources and processes that come together to make pharmaceutical products and services available. It also includes the interaction of all these systems and how they enable timely access to safe, effective, quality assured products, and also includes the related services that promote appropriate and cost-effective use in the community, leading to improved health outcomes. There are several inherent weaknesses within the pharmaceutical system, and they include poor medicine selection, inefficient or corrupt procurement practices, irrational prescribing and dispensing, excessive pricing across all the various aspects of the system, poor storage and distribution practices. It is important that we address and manage these challenges appropriately. Otherwise, we can transfer them to the new expanded coverage of health services and UHC program. In a typical universal health coverage program with a provider-purchaser split, we tend to have a situation where the medicines benefit program interacts with the bigger pharmaceutical system, which still has the challenges that are highlighted. It's important that we address these challenges to enable the medicines benefit program to be sustainable and meet the objectives for which it was set up in providing medicines at affordable prices to the beneficiaries. If that is not done, the situation gets really complicated, and the design of the payment or reimbursement system may impact on the outputs of the pharmaceutical system. For instance, a fee-for-service mechanism may yield behaviors which differ in magnitude and impact from a capitation system of payments. And it's important that these management issues be looked at, because the root of it will be from the pharmaceutical system's pricing mechanisms, which has to be addressed. And that interaction and its management is very key to the ultimate sustainability of our health insurance or our universal health coverage programs. In the next few slides, I will be discussing and highlighting how we can tailor pharmaceutical management efforts to meet our UHC objective. Although the pharmaceutical system has several components, for the purposes of this presentation, we'll be focusing on 7 critical components for measuring the pharmaceutical systems as identified by Helena, Wakowiak, and Hefner in their 2017 paper. The core components include policies, laws, and governance, which supports the overall pharmaceutical system. Financing, how are pharmaceuticals financed? How do we raise money to make pharmaceuticals available? How do we price them? And how do we ensure that the out-of-pocket components of pharmaceuticals are manageable? Human resources, who dispenses, where they dispense, and how they do so. Of course, a critical component is the pharmaceutical products and services, which we have to focus on how we select the products, how we procure them, and how they are used. And again, what regulatory systems support pharmaceuticals. Another component we're discussing in this presentation will be the information systems that support the logistics and distribution systems for pharmaceuticals. And of course, how do all this impact the filling out of the cube, which we described earlier? If we want to increase the breadth in terms of who is covered, these components, when strengthened, will enable us sustainably achieve that. And if we have to introduce new products, again, we have to look at these components to help us increase the depth of services or the depth of pharmaceutical benefits that we come by. So it's very critical that we understand how to approach this. Many countries have rolled out universal health coverage programs only to find out that they're having major challenges with the pharmaceutical component. In a recent paper that we developed, we advocate for 4 key practical steps. One is to advocate for the inclusion of pharmaceutical system stakeholders in the universal health coverage strategy development process. We advocate that they must be included at the very beginning, such that they can be buy-in and there can be ownership towards a common UHC vision. Having done that, countries, together with their pharmaceutical sector stakeholders, can assess and understand the current functionality of these critical components of the pharmaceutical system in terms of what the policies and laws are and how they can help address our objectives of universal health coverage, how are pricing done, what is the current functionality of the pharmaceutical system, and also be able to come up with a collaborative effort on identifying options and prioritizing interventions that are based on the country's context and existing regulatory framework to be able to facilitate and enhance the achievement of our universal health coverage objectives. Last but not the least, be able to come up with a robust monitoring and evaluation system that promotes learning, adaptation, and continual improvement. As pointed out earlier, it's important for us to see pharmaceuticals not just as inputs, but important to appreciate the system components around these inputs. First and foremost is the policy and governance arrangements around pharmaceuticals. It's important that we understand the policies and laws and practices that are essential to make pharmaceuticals readily available. The framework, the structure and mechanisms for selecting, procuring, and distributing medicines are key. And it's important that we answer questions like, are there policies to enhance equitable access to medicines for underdeserved populations? If significant segments of the population cannot access, for instance, a licensed pharmacy, what changes in the laws or regulations are needed to allow non-pharmacy outlets to dispense a limited range of public health priority medicines? What governance and administrative structures are needed to manage a medicines benefit program effectively? These are critical governance and legal arrangements that need to be put in place to effectively ensure equitable access to medicines. In many of our health systems, pharmaceuticals are financed through a number of sources, either from foreign donors or lenders, through private firms and employers, or through individuals. And typically, the money sources are aggregated at the Ministry of Finance level, and then budget allocations done to the intermediary managers, which may include the Ministry of Health, a social security organization, or a private or social insurance system. Then active pharmaceutical purchasing is done And the key players will include either public sector or a profit or non-profit facility and the various retail outlets, with the expected outcome of providing equitable access and financial protection for individuals. It is important that we understand and address some key pharmaceutical management issues, which will include identifying what the current sources of funding for medicines and pharmaceutical services are, also what proportion of government pharmaceutical expenditure or what proportion of the total pharmaceutical expenditure is recovered through user out-of-pocket fees, and then more importantly, to improve access, understanding how the lowest population quintiles pay out of pocket for a set of essential tracer medicines. Another key component is the pharmaceutical products and services. And this is actually at the center of the pharmaceutical system. And it is enabled through the process of evidence-based selection, procurement, distribution, appropriate use. So improving selection of pharmaceuticals through priority setting, using both public and private sector stakeholders to improve distribution and dispensing and the use of medicines, offers an additional point of intervention that will help improve health outcomes and reduce wastage and inefficiencies within the health system. It is also important to analyze and address critical management issues such as how do we set priorities for selection of medicines for coverage of the populations with different needs, given that they are competing objectives in terms of generics and innovative products. How do we ensure equitable access and appropriate use as well as affordable cost? It's also important to understand what the barriers and constraints to utilizing private sector pharmaceutical service providers is. And again, what are the national and subnational availability of essential tracer medicines? What level of adherence to the treatment guidelines or treatment protocols exists, and how can we improve on that? And again, how can we use the financing lever or financing opportunity that is provided through universal health coverage to improve adherence to clinical guidelines? Another important component that needs to be managed appropriately is the information component. We need information to enable universal health coverage policy decisions, information from the pharmaceutical system that includes data on supply sources from manufacturers and for distribution. We also need information on procurement and on the supply chain's performance, the utilization volumes and value, the pricings and markup to enable us negotiate appropriate prices for the benefit package. We also need to have data and information on the treatment patterns, how prescribers are prescribing medicines and how that relates with the general morbidity in the country. It is also very important that we use this information to enable the design of the benefit package. We need information on the enrollment in terms of age group and how that varies with access to services. We also need to use and have this information for understanding how the care-seeking behavior of individuals that we enroll in the universal health coverage programs. The information and data is also needed on the availability of medicines at the consumer level and the pricing of medicines at the consumer level. And for many of these systems, being able to capture this information, aggregate them, and analyze it in a timely manner is what is needed to be able to sustain the health insurance programs or sustain the universal health coverage program. What is even critical for many of these countries is the fact that they are accumulating a lot of claims data. To what extent do this claim data information interact with the other logistics or health system information to be able to give us data and information that can help with timely decision making? So this is a very important component that drives the sustainability of many universal health coverage programs. And it's important that the pharmaceutical management component is properly addressed to enable sustainability over time. We need to address questions that include the supply chain and logistic information management strategies that need to be in place. We also need to understand or address the question, are there robust systems to generate and disseminate timely information for estimating procurement quantities, for tracking pricing, for tracking the products that are registered, for quality and safety, and above all, tracking prices. And as I already pointed out, we need to understand the extent to which the existing health, financing, and logistics information systems are integrated or can be integrated. Finally, we need to look at the workforce, the human resource capacity within the countries, the pharmaceutical workforce's competence, the size and distribution, as well as the capacity to meet the increase in demand for services will be key as we move forward. Countries would need to increase the number of pharmaceutical service providers through strategic recruitment, robust training, and contextually relevant educational programs that will enable staff to cultivate new skill sets that can support universal health coverage. Skills in technical areas such as pharmacoeconomics, health technology assessments, actuarial analysis will be needed to determine which new medicines will be included, how those new medicines will impact the budget, and how they'll be financed and basically used to improve pharmaceutical services. We need to understand what pipeline of qualified personnel are being produced at the pre-qualification level. So key questions that need to be asked would include understanding the current distribution of pharmaceutical cadres, the type, the number, and the geographic locations, and the number of cadres per capita for the bigger population and the number of cadres for insured population. What the pre and the post-qualification pharmaceutical training programs exist, and how do we improve that? Again, is there, or we should look at putting in place a strategy to address any deficits in the availability of pharmaceutical professionals, and also look at potential tax shifting models that would allow lower cadres to do the services that are around pharmaceutical delivery. In many of the countries that SIAPS has worked in, we have looked at supporting them with evidence-based approaches to help reduce the cost of medicines. One of the key examples we have is our work in the Dominican Republic that basically worked with the country to reduce the amount of money that is required to procure high-cost medicines. We basically worked with the countries to run a review of medicines that have been selected. We made proposals on options for replacements or alternate products which cost less. And over time, the country is procuring less high-cost medicines and more of the lower-cost medicines with improved health outcomes. In terms of improving the information systems around procurements and logistics, Bangladesh is a good example for countries to look at. Support from USAID, the SIAPS project worked with the Bangladeshi Ministry of Health and stakeholders to set up procurement management, supply chain management portal, which basically adds a lot of transparency in the processes around procurement, pricing, and delivery of medicines. And for listeners who require more information, going on the Bangladesh Supply Chain Management Portal, you can see how that system has worked and improved transparency around procurement and also delivered timely information for decision making for family health products and other essential medical products in Bangladesh. We certainly believe that the Supply Chain Management Portal has been a game changer in improving procurement and supply chain efficiency in Bangladesh. So that prepares the country in this rollout of universal health coverage as planned in the coming years. So before I end, I'd like to thank my colleagues, especially Ms. Megan Rachel, who helped in the development of the technical brief, which is available online in the website shown below. I also want to thank the director of the SIAPS program, Mr. Francis Abuaji-Nyami, for his support and inputs and in reviewing most of the work we've done over the years. I also want to thank Mr. Tony Boney and the USAID AOR team for all the support, funding, and inputs that they have made over time in this area of advocating for the inclusion and for the strengthening of pharmaceutical system in our quest to improve universal health coverage. Once again, thank you for listening to this program, and the floor is open for any questions, and we can spend the next several minutes addressing the questions that you have. Thank you.